I'm going to give a quick introduction of Dr. Gurian so you know a little bit of his background. He graduated from Temple Dental School and he was a practicing dentist, but also a comedy writer, performer, director, author, producer, and radio personality, lots of things. And he was, in addition to all of that, a clinical professor at NYU in the medicine and oral facial pain department. And he's been on the board of the Association of Spirituality and Psychotherapy. He's the author of books, and his newest book, for the first 50 who registered students, I sent an email to you. Please stop by my office to pick it up. So without any further chit chat from me, thank you again. We're in session 3, and it's a body, mind, spirit approach to dentistry.
Thank you so much, Dean Nyquist. It's really great to be here with all of you. And I welcome any newcomers. I'm just curious to know, I guess by a show of hands, you can click that little hand thing. How many people have been here for the last 2 sessions? And if there's anybody new, if this is your first session, could you please raise your hand? So I get a sense of how many. And I'm gonna make a request that if you're presentable, that you allow yourself to turn on your camera so that I'm not just talking to black boxes with names on them, because a lot of this is about energy. It's about a transfer of energy. And it's really hard. It's really hard to do that when you can't see anybody. So it's really nice and I appreciate it. Thank you for turning on your cameras. I hope you didn't let the gray day interfere with your mood. In last session, we talked about sensitivity, and people that are sensitive are very affected by things like weather. We're affected by weather and color and the room that you're in and the people that are around you. We're affected by so many things, and true ultrasensitives feel those things very deeply. And what I want to start out with is the last time I finished by going over this ultrasensitivity test. And some of you may have answered the questions, but I want to go over what the categories of sensitivity are. And again, sensitivity is a very important thing to discuss when we're talking about dealing with patients, because you deal with all different kinds of patients, and some are going to be wonderful and some are going to be challenging. Let's put it that way. And it's important to use your sensitivity in a way that makes people feel welcome. So I'm going to tell you what the questions were, and then I'm going to tell you the categories that they fell into, in case you wrote down which ones pertain to you. So the first question was, I have the ability to feel what other people are feeling as if I was feeling it myself. And if you answered yes to that, it means sometimes there are several categories. They call them feeling ultrasensitives, where you often say, I feel this way about something. They're also called sponge ultrasensitives or emotional. And I don't usually read when I speak, but in this case, because there's a lot of information, I have to read it. So I took notes on what each category is about. Sponge ultrasensitives connect with people on a very deep level. And once they own their sensitivity as a strength and not as a weakness, they make very good counselors, teachers, or members of any profession that needs that depth of understanding. Dentists are about as close as you can come to being psychologists and psychiatrists. You'll find that as you build a practice and as people come to you, they'll start to open up to you about their lives and about their problems. And basically, people trust dentists more than physicians, really. Like once a person trusts you, they'll stay with you forever. They're more likely to change MDs than they are to change dentists, because there's so much fear in the general population of going to the dentist. that if you can establish a sense of trust, they'll stay with you forever. And sponge ultrasensitive also, they hold on to relationships that are painful way too long and way past the point that they are positive experiences for them in their lives. We don't like to hurt anybody. We'd rather hurt ourselves than hurt someone else. So we stay in situations that are not always the best for us longer than we should, because it's hard for us to say yes and no. The next question is, I relate to the world by following rules and regulations. I have the ability to say yes and no. And those are structural ultrasensitives that lead their lives in a very rigid way. They follow directions. Sometimes that was given to you by your parents, who may have been very strict, sometimes in a boarding school, but these are the people that are very rigid in terms of following directions. I make my choices from the information available to me at the moment, even if in the same situation in the past, my choices didn't work out. I think of it as being optimistic that things will work out this time. Now, there's a definition of insanity, and I don't know if you guys have heard it, but it's doing the same thing over and over again, always expecting different results. So some people look at that as insanity. I happen to be a conceptual ultrasensitive also. I always look at it with optimism. It may not have worked in the past, but this time it could work. And those are the people that persevere. They follow a goal until they achieve success. They don't give up. I often feel confused, as if I was born without the book of rules that everyone else seems to have. And again, those are conceptual. They're very sensitive, very left brain people, conceptual ultrasensitives. Next question was, I often ask other people who are having the same problems as I have to tell me what they did. And each person has a different answer, which confuses me even more. Now, I'll tell you, beards are very popular. Years ago, when I wanted to grow a beard, it sounds very silly, but I asked other guys, how do you grow a beard? Because I couldn't figure it out. I thought there was some trick to growing a beard. I wanted a beard that looked like your beard. And some guy said to me, you just let it grow in. However it grows in, that's your beard. You can't grow another guy's beard. When I wanted to start wearing scarves, I wear a lot of scarves. Men have very few alternatives when they dress, and I happen to like scarves. But when I first started wearing them, a lot of people have very interesting ways of tying their scarves. It was very confusing to me. I would ask people, how do you wear that scarf? So I have to learn by asking things. Those are the characteristics of conceptual ultrasensitives. I have a very poor sense of time. I always think I have more time than I actually do. Some of you may find that time is a problem for you, that you're late for things. Anybody have that experience? You can raise your hands on the thing if you do. Time is a hard concept for a lot of people. What I've had to learn in my personal life is that if I have to be somewhere at 12 o'clock, I have to leave at 11 o'clock. That means I have to start getting ready at 10 o'clock, which really means 9:30, because somewhere along the way, I'm going to waste a half an hour. I get distracted easily. And if any of you experience ADHD, that's ADD in high definition, it causes a lot of confusion. And time is a concept that is hard for a lot of people to grasp. As a dentist, you work on a schedule, which helps a lot. When you're working on a schedule and you really try to keep to that schedule, it helps you to manage the concept of time. But in your personal life, you may be a person who's often late for things, who finds it hard to grasp time. And that puts you in the conceptual category. Next question, I experience life mainly through the awareness of seeing. I often say, I see what you mean. And those are visual ultrasensitives. They relate to the world through sight. I am highly visual and can actually picture things in my mind's eye, which again is very helpful as a dentist because we're one of the few professions where there's a real artistic side to our field. So if you have if you're a visual person, you can envision what something should look like. My specialty was cosmetics. So I was involved in the very early days of bonding. And I became like a cosmetic specialist. And sometimes I would spend 6 to 8 hours doing a case, taking someone with very crooked teeth and making them look straight and beautiful within the course of one visit by just using cosmetic bonding. This was before porcelain veneers. And, you know, it's a real artistic field. The only ones that are that function in artistic ability the way we do are plastic surgeons, you know, and we're actually plastic surgeons for teeth, which is a good way to look at it. I know things without knowing how I know them. I sometimes surprise myself by talking about things I didn't know I knew. And those are called knowing ultrasensitives. And very often, if you're open to the concept of past lives, sometimes information comes to us that we're not aware that we know. You can find yourself speaking about something and you're not even sure how you know it, but you feel confident talking about it. And in my particular case, when I was only 7 or 8 years old, I already knew that I could put my hands on people and take away certain types of pain, which we're going to talk a lot about at our next session when we talk about treating TMD and bruxism and the physical symptoms of that, just using energy, no drugs or injections, just releasing muscle spasms and things like that with just your hands, which is what I did at NYU for 12 years. I was a clinical professor in oral medicine and orofacial pain. And they saw me doing this in the clinic, taking away headaches from people just with my hands. And I wound up lecturing for the head of the TMJ department, who asked me to lecture to the postgraduate students on that technique. And then the head of oral medicine asked me to lecture to the entire faculty on it, which was really a wonderful thing because a lot of places are not open to that concept. But, you know, since they saw me there, I was on staff for 12 years, they trusted me and they allowed me to talk about that. And it's something that's very real, a transfer of energy between you and your patient. Let me see. So we're up to, I feel things very deeply and they touch me. I often say I feel when answering questions or giving information. So those are feeling ultrasensitives. They also like the texture of things. Their sense of touch is very well developed. They have a very sensitive sense of touch. I can often feel what has happened in the past of another person, place, or thing. Next is I absorb the feelings and sensations of those around me. I am released from an emotional tie only when the other person breaks it. I hold on to painful relationships much too long because I can't bear the pain of losing them. And I can connect with people on a very deep level of experience. Now, those types of people are what we call sponge ultrasensitives. And sponge ultrasensitives, again, as I said, once they own their sensitivity as a strength and not as a weakness, they make really good counselors, teachers, or members of any profession that needs that depth of understanding. The next category is I can use what's happening in my own life to experience the condition that's troubling someone else, which is also very helpful. And I have arrived at the conclusion that I have experienced great difficulties in my own life so that I'll be more able to empathize with others. And this is going to tie in with the spiritual concept that I'm going to be talking to you about. Sometimes we find ourselves faced with tremendous frustration and obstacles that seem to appear out of nowhere, especially just as we get close to something, to achieving a goal, something weird happens. Like in my first year of dental school, our 1-year project was making a set of dentures. That was it. I mean, obviously we had a lot of other things to do, but we had to make a set of dentures and we had to hand them in order to go into the second year. They had to be perfect. And about 3 days before, I ruined my dentures. I got porosity in my dentures. We had to process them. We had to do our own laboratory work. I don't know. Do you still have to do your own laboratory work? Do you have to cast up partial frameworks and things like that? Click if you do, like hands, so I get some feedback. Nope, you don't have to do that. Let me see if anybody wrote. Well, when when somebody wants to know if it's too much tuna, it's never too much tuna, just so you know. You know, it took me off my train of thought. When I was in school, like I said, we had to do our own lab work. We had to cast up gold inlays, and we had to make the metal frameworks for partials, and we had to do it all ourselves. And we had to make a set of dentures. And because I didn't have a team around me, I wound up working by myself. This was a story that I told in my first lecture about what happened to me at Temple University a very long time ago, and how much the culture has changed over the years, thanks to Dean Ismail and the culture of inclusivity that he created. But at the time, so I ruined my dentures, and I had to redo the whole year's project within about 2 or 3 days, which was insane. And I was able to get it done somehow. I don't know how. It was an overwhelming amount of work. And I thought to myself, why do these things happen to me? And it kind of set me up, because as you go through life, you have a lot of those things happen. Very unexpected obstacles cross your path. And you can either crumble from the stress, or you can rise above it and overcome it. And I to be honest with you, I don't know how I did, because I had to study for a gross anatomy test at the same time. And anybody who wasn't present for the first lecture, the gross anatomy instructor let me sneak a human head out of the gross anatomy lab. I had to take a head home in a paper bag. And I lived in a small apartment alone, and I dissected the head on one end of the table and I ate on the other end of the table. That was my experience in dental school. And I finished the dentures and I passed the gross anatomy exam. And I'll never forget the level of stress that I was under. Let me see. So that's about handling obstacles in your life. The next is, I tend to create change or enter people's lives when they're about to experience change. People tend to pass through my life instead of remaining for long periods of time. People come and go out of your life. And those sensitives are called catalyst ultrasensitives. They seem to be able to create change in other people's lives. They help them. As dentists, we are catalysts. You can have somebody come in with terrible dental problems, and you can change their life completely by doing what you do, which is an amazing thing. That's one of the things I really loved about cosmetic dentistry, was taking people who had very low self-esteem and a real lack of self-confidence, and give them a beautiful smile and watch them bloom as human beings. They completely change. Because if you feel self-conscious, you know, there are always people, they talk like this. They put their hands over their mouth so you don't see their teeth. They're afraid to smile. You know, they're like, don't tell me any jokes because I don't want to laugh, you know, and you have an opportunity to really change people's lives, which is a very, very exciting thing. So those are catalysts. And that's why people may enter your life when they need help with something, and then they disappear. You wind up helping them, and then they disappear. So if you're the kind of person where people come and go in your life, especially when they need help with something, then you're a catalyst ultrasensitive. The next category was I often talk about things that other people cannot understand, but I find interesting and I want to learn more about it. I feel that I must make a difference in the world, and I don't open up to others about obstacles that I face. I keep it to myself, and I'm very hard on myself for what I feel I should be doing, but are not doing. These are people that are very committed to reaching their goals, and they're considered bridge ultrasensitives. And bridge ultrasensitives tend to be leaders and pioneers in their fields. They're very inventive and creative, and they create a sense of unity in any group that they join. They can also help others to see what their next step should be. And they never give up. They persevere until their goal is reached, and they let no obstacles stand in their way. Sounds like Capricorns to me, if any of you are into astrology. Let's see. So next is, I can sense potential danger in almost any situation. And I do not like to travel or be in any situation I don't have control over. And these are considered negative potential ultrasensitives. They can always see the other side of things. Not that they're negative people, but they can always see the downside of some concept, of some idea. They might warn you about something that you're about to do, that maybe it's not a good idea for you to do that. Not necessarily that they're psychics, but that they can see both sides of a coin. And if you remember what I said about myself when I did this the last time, unfortunately or fortunately for me, I'm every single category. So I understand all of this much too well, because it took me a very long time to be able to own my sensitivity, not as a weakness, but as a strength. Okay, let's see. And I do not like to travel, but yet, as I said, I went to Japan alone. I went to Europe alone. I went to the Cannes Film Festival alone, challenging myself all the time to do things that make me uncomfortable. I tend to use logic to make decisions rather than my emotions. I can only express my emotions after having a drink or two. I can be highly judgmental of others and myself. And I do what I feel I should do rather than what I really want to do. I resist change in myself and my surroundings at all costs. It makes me too uncomfortable. All of those questions are what they call blocked ultrasensitives. And blocked ultrasensitives don't feel comfortable with their sensitivity. They try and block it in order to survive. They feel that they need to block their feelings in order to survive. But when they find someone that they think really deserves help, they put that person first before themselves, and they give a lot of themselves. They can stop crisis and emotional pain, or even something as severe as suicide. They can stop someone from doing something drastic by giving them another point of view. They're the only group that can stop or block time for the moment. And they also have the ability to block a negative happening for the moment. So blocked is not really negative. They have their own special attributes. And the last category is, I have many of the above characteristics. There are some people like myself that they consider, they're called multi-talented ultrasensitives. They have many different categories, which again can lead to a lot of confusion in your life if you're dealing with this, because as you get older, it's a little bit easier to handle. But especially when you're under stress, like in school, like you guys are in dental school, where there's so much stress all the time and a lot of things are being expected of you, not only by the school, but self-imposed pressure that you put on yourself, pressure from your families to be successful. You know, we spend a lot of money to go to dental school, a lot of time, it's a huge, huge effort. I don't think most people have any idea what it's like to become a professional, to become a doctor, how much work is involved, you know? And so for those of you that do have these, that do fall into these categories, try and understand yourself and be kind to yourself. If you're facing confusion, if you're facing all, any of these things or all these things, and understand that that's part of your makeup and that it's going to help you. The more sensitive you are, the kinder you are as a person. And that's going to help you in practice, because your patients will feel that and they'll understand that you'll empathize with them. So I talk about a body, mind, spirit approach to wellness. And let me explain that to you. I'm going to back up again and talk about the spiritual aspect, because it's very important to grasp that, especially anybody who's new this session and didn't hear this from before. A lot of people confuse spirituality with religion, and they couldn't be further apart. You can be very spiritual and not religious, and you can be very religious and not spiritual. So religion can be wonderful for people. There's nothing wrong with it, but it tends to divide us because it puts you in a category, and other people are automatically outside that category if they're not part of that specific religion. And what spirituality does is it brings us all together, because all it asks is that you believe in a force that's greater than yourself. And it's an interesting concept. Yeah, you could call it nature, you could call it the universe, you could call it God, whatever is comfortable for you, as long as you know that it isn't you. Because when you're under the impression that you're running your whole life and everything is up to you, when things don't go the way you want them to, you tend to blame yourself. And that's the source of a lot of emotional illness. So I spent 20 years on the board of the Association for Spirituality and Psychotherapy, teaching classically trained psychotherapists what physical symptoms to look for that are caused by stress and very often connected to a TMJ problem caused by bruxism. During times of stress, people tend to clench and grind their teeth a lot. And my problem with that, I had that. I seem to have every problem that I treat. So I had that when I was a freshman at Temple. I woke up in the morning, I couldn't open my mouth. I thought I had lockjaw. My muscles were so tight from all the stress that I was under. And like most lay people, they don't know what that is. You can't wake up in the morning and say, my splenius capitis muscles are sore. It must be my TMJ, because you don't have that information on your hard drive. So I went to the clinic and they diagnosed me as a grinder. And in those days, they did something called trying to equilibrate my bite. Don't ever do that. It made it a lot worse, because then I had no bite. They ground down a lot of contact points and I was constantly shifting my jaw, and it really gave me a lot of problems. And anyway, so I approached the Association for Spirituality and Psychotherapy. I explained what my background was, and that a lot of people that they work with who have emotional illness, especially something like depression, are probably clenching and grinding their teeth. There are a lot of reports that during this pandemic, a lot of dentists have experienced seeing cracked teeth in their office. A lot of people are coming in with cracked and broken teeth. And the reason is because when people are stressed out, that's a very common habit. There's only so many habits that a person can have. No one developed a habit that no one else had. One of those habits I look at, one of those habits is bruxism, clenching and grinding the teeth. It's very, very common and very associated with stress. So the spiritual aspect, as I said, when things don't go the way you would like them to go, you can't blame yourself. You have to understand that there's a path for each person and certain things are going to happen. And one of the principles that's important to understand and to incorporate into your thinking is that if you don't get what you want, it's not because you're being punished. Because it can look like everyone else gets what they want, but when it comes time for you to get what you want, things don't work out for you. So the concept is that if you don't get what you thought you wanted, it's because you're supposed to have something better than that. And if you got the thing you wanted, you wouldn't be available for the really good thing that's coming to you. But you have to have patience. And unfortunately, that's one thing that's lacking in human beings. It's hard for us to have patience. We want everything that we want right now. We tend not to want to wait for things. And so there's a whole bunch of principles that I'm going to talk about later in this particular lecture. I'm going to mention some of the spiritual principles to incorporate into your thinking to take away stress. Because in times of stress, we're not thinking clearly. Very often, we're not at our best and we're not making great choices. And so it's very important to look at things in a spiritual way, to understand that this is part of your path for whatever reason. When I was in the hospital with a heart attack, or when I was laying there with COVID double pneumonia this past March in the hospital, it would be very easy for me to start feeling sorry for myself. But I looked at it as a very bizarre experience. I'm like, why is this happening to me? I was never sick. Now all of a sudden I have a heart attack. And I had what they call a widowmaker heart attack, which was very serious. Not that there's any non-serious heart attack, but this one, they said I was about 95% blocked in my LAD artery, which is the main artery to the left side of the heart, as you know. And I had to understand that for whatever reason, this is part of my path. You can't only accept these principles when life looks like it's great, when it feels like everything is working perfectly for you, when everything is going just the way you'd like it to. It's when it feels like nothing is going right that these principles are important. So I had to shift my mindset when I was laying there in the hospital. I had to really create a positive mindset for myself, because when you're in a negative space, your vibration level drops and your immune system is not functioning well. And when you're in a very positive space, like when you're happy and you're laughing, you're in a comedy club, you're having a great time, you're with your friends, you're having a wonderful time, your vibration is high and your immune system will work well. So I had to work on my mind. I had to practice what I preach. It's not enough to just talk the talk, you have to walk the walk. So when they put the stent in my heart and they let me out of the hospital a few days later, they said, try and lead your life like this never happened. So how do you do that? I mean, people are not used to just having a heart attack in the middle of the day. I went back on stage to perform comedy 5 days later. And the owner of the comedy club couldn't believe it. He said to me, are you crazy? You just had a heart attack. And I was like, yeah, but it's hard to get a spot here and I don't want to lose my spot. And so, you know, it's how you process things. When I was in the hospital in March, I was really, really sick. I had COVID double pneumonia. And as I may have said last time, I got it in March because I like to do everything right away. I wanted to be first. I didn't want to have to wait. So I got sick right away. And it was not how I planned to go viral, by the way, but it's how it wound up. And I was laying there in isolation. For the first 2 days, they had me in an isolation room. And on my third day, they moved me into a room with 3 other very sick men, all with the virus. And I don't know if they were kidding me or not, but they told me that the man in the bed next to me was from Wuhan. And let me tell you, that added a lot to my stress, because he was very sick and he didn't speak English and he was coughing into the air with no mask. And I was laying right next to him. And there was no other place to put me because they ran out of rooms. New York City was the epicenter of the virus. And they had so many people that were sick, they were putting people in the hall. So there was no other place to put me. And I had to create a positive mindset to get through this, because all that was between me and this man was a very thin curtain. And everyone knows that if you want to block out a serious virus, you don't hang a very thin curtain there. It's not particularly effective. And so when they told me they were going to send me home, I didn't argue. I was very happy to leave that situation. But I laid there next to that man for 2 days. And believe me, it took all of my mental strength to put myself in a situation. I was joking with the nurses, and they would come by and they'd spend time with me, and they'd sit on my bed and they took my hand. They said, "Don't worry, you're going to make it. You're going to be okay. You're going to survive," you know? And I can't tell you how important that was. Those little acts of kindness. And you'll have the opportunity to do that in your practice, not with people that have COVID, hopefully, but people who are in need of help in some way, people who are emotionally troubled, or people who have all kinds of things. But you'll have this opportunity as part of what you do as a dentist to be there for people emotionally. You know, so a body, mind, spirit approach, I can explain it best when we're talking about dealing with people with emotional illness. How I explained it to these psychotherapists and psychologists, psychiatrists and psychologists, is that when you give people medication, you're treating their body. When you talk to them, if they go to a psychiatrist or psychologist, you're treating the mind. That's body and mind. But you must also take the spirit into account. You have to understand why they're having the problems that they're having. It's not enough to just give somebody pills or tell them that they're going to be okay. If somebody is troubled, it's important to try to find out what the reason is, where it's coming from. So I developed a very long questionnaire, and I would talk to people about their background, everything. It's about everything in their life. I think I mentioned that I work with stutterers. I stuttered very badly. Even when I was in dental school and beyond, into my 30s, I was blocking. I could never say Gurian. I stuttered really badly. And I was able to cure myself through a lot of hard work by using a lot of the principles that I talked to you about. Controlling your mind. I realized one day that I didn't stutter when I was alone. I could speak fine. I only stuttered when I was trying to talk to somebody else, which told me you can't have a disability based on your location. If a man has a limp, he limps in every room of his house. He can't go into a room and close the door and walk perfectly. But if I could speak fine when I'm alone, theoretically, it means there's nothing wrong with me. And so I took that and I ran with it, and I worked on myself for years because there was nobody else to help me. And I was determined, because of my own makeup, I don't let obstacles stand in my way. And I knew that, you know, I knew I was a kid. I was stuttering since I was about 6 or 7 years old. I knew I wanted to be a doctor, and I knew that a stuttering doctor doesn't really work well. You know, people don't look at a man who's stuttering and say, what a calm, confident person. A stutterer gives off the image of being nervous and not having confidence. And I knew that I couldn't go through my whole life like that. I rejected it. So I worked very hard, and I developed techniques to cure myself. And now, as an avocation, I work with stutterers all over the world, just like we do here on Skype usually, not on Zoom. And I teach them how not to stutter by learning to control their mind. It's a lengthy process. It's not easy, but you can control your thoughts, believe it or not. So when you have uncomfortable thoughts, there's a way to get rid of them. And so there's a saying that I like to use: you can't get better with the same mind that got you sick. Each of you already knows your own thoughts. And if those thoughts are not working for you, if you're making decisions in your life that are not working out for you, if you have the same, what seem like patterns over and over again, you know, some people get the same bad job, or they're in the same bad relationship over and over again. They pick the same people to get into a relationship with, and the relationship never works out the way they would like it to. The only common denominator is them. They're the only person that keeps showing up. The other people change. So it can't be that all those other people are wrong. Sometimes the problem is with us. And so you have to look at those things. So when we talk about a body, mind, spirit approach, there's a spiritual answer to all of our problems. I don't know if any of you were familiar with the great Wayne Dyer, who passed away recently, a leader in consciousness, wrote probably more than 30 books, gave Deepak Chopra his start in terms of consciousness. And they understood the power of intention and the power of spiritual principles, using spiritual principles in your life to accomplish things or to change your mindset. Some of those principles are gratitude and service. Very important, two very important principles. If that's all that you take from these lectures, gratitude and service. Now, being a dentist, you're automatically doing service to other people. There's no greater thing that you can do as a human being than to take care of somebody else. That's tremendous service. But in terms of your own peace of mind, in terms of your own emotional wellness, the concept of gratitude is very important. There's a tendency for people to engage in, what's the word? I'm blanking on the word. Feeling sorry for yourself. Self-pity. Very often when things aren't going the way we'd like them to, we engage in self-pity. And that's one of the worst things that you can do. And if you ever find yourself in that situation where it feels like nothing's going right and the whole world is against you and everyone else seems to be doing better than you, sit down and write a gratitude list. Because a gratitude list is very important. And it could be as simple as the fact that there's nothing wrong with you and all your senses are working and you have certain strengths and you're good at something. When I wanted to cure myself of stuttering, one of the exercises that I did was I took a piece of paper and on one side I wrote good and the other side bad. And on the good side, well, I'll start with the bad side first. On the bad side, I wrote all the things that I didn't like about myself. And that's not easy to do, but you can write that on a piece of paper and no one's ever going to see it because when you're finished, you can tear it up. But it's important to be honest because every one of us has things about ourselves that we would change if we could. But there are certain things that we can change, and that's where the concept of acceptance comes in. Acceptance is a very, very important concept, to be able to accept yourself for the way you are. There are certain things that we can change about ourselves, but there are other things that we can't. And if I hadn't been given the grace to understand that I could change stuttering, I would still be stuttering today. But there are certain other things about ourselves that we can change. They're immutable. And it's very important to accept those things. So when you make a gratitude list, you write down everything that you could be grateful for. You know, I have parents that care for me. I have siblings that love me. I have friends. You know, I have the opportunity to be in a profession where I can help people. Yeah, and you should be able to write a list of at least 10 or 15 things when you're in that space. And a gratitude list is very important. And so when I was doing this good and bad list, you write down all the things about yourself that you don't like. And then you write in the good column, all the things about yourself that you do like. And you'll be amazed that there's a lot of, that good should definitely outweigh the bad. There's a lot of good stuff about yourself that you may not be seeing for some reason. Some of us block that. Some of us engage in self-sabotage, where at the very last minute, we make sure that things don't work out the way we would like them to, you know? And you have to be very careful with that you don't manipulate things, because we tend to manifest our worst fears, which is a very interesting thing. It's one of the reasons that I wrote this book that some of you are going to get. It's called Fight the Fear, Overcoming Obstacles That Stand in Your Way. I know I have it around here somewhere. Oh, I covered up my own book. Here it is. Fight the Fear, Overcoming Obstacles That Stand in Your Way. And it shows a guy on a winding road, because that's what life is like. It's like a winding road. And there's a road closed sign in the winding road, but there are two angels that are lifting up the road closed and flying away with it. And sometimes what you'll find is that you're in a situation where you don't know how you're going to get out of it. It looks like an overwhelming obstacle, but you can make it. You can change that. You can overcome just about any obstacle that stands in your way. And it's important for you to know that. So when we're dealing, again, with spiritual principles, it's a way of thinking. There's a lot of power to the power of positive thinking. It's not just a cliche. It's not just a statement. The interesting thing, when I work with stutterers, and I use that as an example a lot, because what I did was I created in my subconscious mind, your subconscious mind doesn't know the difference between fact and fiction. Believe it or not, it believes whatever you tell it. So if you tell your subconscious mind, if your inside message is that you're a loser, you're going to draw that into your life. But if your internal message is that you're a winner, that you can accomplish anything you want to, you'll also draw that into your life. So you have to be very careful what you dwell on, because you can manifest the wrong things. That's why a lot of cancer phobics wind up actually developing cancer, because that's all they think about. They put out so much energy thinking about cancer that they draw that into their lives. So you have to be careful that you don't dwell on the negative and that you stay in the positive. And it's important to acknowledge our weaknesses as human beings, but it's very important to acknowledge your strengths. That's a really critical key. It's not egotistical to know what you're good at, because you're also acknowledging at the same time, you're acknowledging your weaknesses. And I don't know if I read it to you last time, the statement about fear. I use this a lot in a body, mind, spirit approach to people when I'm working with people trying to change their mindset, because a lot of people experience fear. That's one of the reasons that I wrote that book. It had been on my mind for years to write it. But when I was quarantining, after I got out of the hospital, I was sick for a couple of months. And then I didn't leave the house because I was nervous to go anywhere. And I wrote this book within that period of time, over a few months that I was in the house. And there's this statement. Some of you may have heard it last time, but some of you may be new. And I'm going to read it again because it's a very powerful statement, and I use it a lot in all of my work. It's called About Fear. Our deepest fear is not that we are inadequate. Our deepest fear is that we are powerful beyond measure. It is our light, not our darkness, that frightens us. We ask ourselves, who am I to be brilliant, gorgeous, talented, and fabulous? Actually, who are you not to be? Your playing small doesn't serve the world. There's nothing enlightened about shrinking so that others won't feel insecure around you. We were born to manifest the glory within us. It's in everyone. And as we let our own light shine, we unconsciously give other people permission to do the same. As we are liberated from our own fear, our presence automatically liberates others. To me, that's an amazing, amazing statement. And it's taken from a book by Marianne Williamson. And it's called A Return to Love. She teaches something called A Course in Miracles. And what it basically means is that we're afraid to shine. We're afraid to be the best that we can be. Sometimes we hold ourselves back. Sometimes it is through self-sabotage. But the point is that it's okay to be successful. It's okay to be amazing. It's okay to be a superstar, because when you do that, you become an inspiration to other people. It doesn't make you look egotistical. It doesn't make it look like you're trying to be a big shot, because humility is another important aspect. You know, it's always people respect people that are humble. You know, I'm sure you've all seen, like, a lot of celebrities seem so taken with themselves. I was thinking about it today, about the ego involved in show business. I've been backstage with many, many big stars, and I've experienced on a firsthand level. And ego can be very uncomfortable. Show business is all about ego. You know, when you go in to buy a shirt, The guy just gives you the shirt. He doesn't give you the shirt and a picture of himself and say, this is who I am and this is what I do. But in show business, you're always telling people who you are and what you do, and you're giving them pictures of yourself, you know. And humility is very important. People don't respond well to that, to people that are show-offs. You know, we've all met people that are like that, and it kind of turns you off. So humility is a very important thing, but there's a balance. You want to be proud of your accomplishments, but not to the point where you come across as egotistical. So you want to establish a sense of humility, and that's tied in with gratitude and service. That's another principle, the principle of humility, of being excellent at what you do, striving to be the best at what you do. And that's okay, because then you become an inspiration to other people. They look at you and they say, wow, he did that. Maybe I can do that too. Dean Nyquist was saying that the last time, that in her yoga class, when she does these difficult poses, that maybe some people who are just starting out can look at her and say, wow, if she can do that, then I can do that too if I work hard at it. You know, so each of you, hopefully you have mentors, you have people that you look up to in the field. And you'll see some dentists go on to become very, very successful. And that's awaiting you, that's out there. It's a very exciting field. There is new things all the time. Dentistry is one of the fields that has accomplished so much in the last decades with the advent of cosmetic dentistry and all the new things that come up all the time. It's amazing. So there's so much opportunity out there. And as I said, the sky's the limit. You can create anything you want if you have the mindset. There's an abundance in the universe, and you're welcome to participate in it. You don't have to think that that's not there for you. Other spiritual concepts are, we mentioned this last time. Someone asked about resentment and forgiveness. Resentment is like you taking poison expecting the other person to die. Sometimes people do the wrong thing to us. They hurt us in some way. You know, and in business that happens a lot. You have a partner, you think he's on your side, and he does something that you don't expect, really upsetting. Or it could happen in relationships, and you wind up resenting somebody. And it's important to work towards letting that go, because the only person that it hurts is you. When you resent somebody, especially if they don't live with you, somebody did something to you, and you carry that resentment, you allow them to give you a stomach ache and a headache and make you sick. And they're not thinking about you at all. They're going about their life like nothing ever happened. And you're dwelling on it, and you're giving them too much power. So when you resent someone, you're giving them power over you. And so that's why it's important when you forgive somebody, you're doing it for you. It's not for them. I mentioned this the last time. In my spiritual studies, I've been studying for about 24, 25 years now, and they tell you to pray for people that you hate. And I'm like, what sense does that make? Why would you do that? How could you pray for someone that you dislike, someone that really hurt you? You know why? Because they don't know that you're praying for them. They don't know. You're doing this for you, not for them. You're doing this to cleanse yourself, because that's like you taking poison, as I said. It's hurting you. And it's not hurting them. So if you send out a prayer that they're happy, if you want them to be happy, that comes back to you. If they're happy, you'll be happy. They won't be making you miserable anymore. So you're doing this in the privacy of your own home. As I said, they have no idea that you're praying for them. They would be shocked if someone that did something to hurt you knew that you were praying for them to be happy. They would be totally shocked. But again, you're doing it for you. So what all this is about is letting go of unhealthy patterns by changing the way you think. And what I'm going to do, I want to leave time for some questions if there are any. So I'm going to end this by repeating some spiritual wisdom from my first book. I did 2 books in this happiness series. So Fight the Fear is the first one. I'm sorry, Fight the Fear is the new one that some of the students are going to be getting. The first book I did on happiness was called Healing Your Heart by Changing Your Mind, a spiritual and humorous approach to achieving happiness. And it's got a meditating dog on an orange pillow. And you can only imagine how hard it is for a dog to get into lotus position. Not an easy thing. These are some of the sayings that I took from my book. And maybe they'll resonate with some of you. Some will, some won't, whatever. Take what you need and leave the rest, you know, as they say. Don't dwell in the past. It's okay to look back, just don't stare. Yesterday is history. Tomorrow's a mystery. Today is a gift. And that's why they call it the present. I love that one. The job of God is taken, so don't bother applying. If you have a problem and you can't solve the problem, chances are you are the problem. Guilt is paying interest on a debt you don't owe. You can't get better with the same mind that got you sick. Don't give up before the miracle happens. Don't mistake self-loathing for humility. That's an important one. Your head is like a bad neighborhood. Don't go in there alone. If you're having a conversation and you're alone, chances are it's not a good conversation. Alcoholism and drug addiction are more often than not a low-level search for God. Fear is the opposite of faith. When your faith is strong, there's no room for fear. Fear and faith cannot coexist. Before speaking, quote unquote, honestly to someone, take a moment and ask yourself, does this really need to be said? Does it need to be said now? And does it need to be said by me? You know, sometimes in the effort to be honest, we hurt someone's feelings. And we say, well, we're just trying to be honest. So you have to question what your motives are. And that's another important spiritual principle, always questioning your motives before you say or do something. Are you doing it in a self-serving manner? Are you doing it to really benefit yourself in some way? Pain in life is inevitable. Suffering is optional. Expectation is the precursor for resentment. And the suggestions made in this book are free. The only ones you pay for are the ones you don't take. And lastly, if after reading this book you try these principles in your life and you're still not happy, we'll gladly refund your misery. And so with that, I want to thank all of you for attending and see if there are any questions, anything that anybody wants to say. Again, I gave my email last time. You can write through Dean Nyquist, or you could send me something. Some people sent me some really nice messages about what they got last time. It's jeffrey@jeffreygurian.com is my email. So if anybody has any comments, feel free. You can write to me directly if you want. Where does humility come into believing you're a winner? And that's what I meant when I talked about the balance. There's a balance in everything. Yes, you can be a winner and still be humble. And people can tell by the way you act that you're being humble about it. You can't think that it's just you that did it through all of your actions, that you were allowed to achieve whatever success you achieved because that was the universe's plan for you. Sometimes it'll coincide with your will. Sometimes you won't get what you want because the universe had a different choice for you. It was not their will that you get this certain thing that you want. But when your will coincides with the universe's will for you, you'll get what you want. So being a winner doesn't necessarily mean that you have to be egotistical. There's a lot of successful people out there who can be very humble and they're very comfortable to be around. Do I love my ex-wife the same way that I did? That doesn't really make sense. I care so much for my ex-wife because she blessed me with children, and I honor her for that. And we've been close. You know, I attend events with her and her new husband and their children and my children, and I have a very big extended family because of the principles that I've been speaking to you about. I've been lucky enough to be able to incorporate them into my life. So, you know, it never made sense to me, people who are married who hate each other, you know, especially if you have children. That's a very special gift. When someone gives you that gift of children, how could you hate them? It wouldn't be those children if it wasn't for that other person. So luckily, she and I both think the same way. And as a result, I have a very big extended family. On holidays like for Thanksgiving or any religious holidays, we spend them all together. And it's people of all different religions and different backgrounds. And I have one big extended family. And it's all because of these principles and what I've been talking to you about.
So my question was, this one sentence: when two things came to him, he would see which was more emotionally desirable and do the contrary. Now, it seems like probably a lot of us suffer from doing the contrary because we're, I would imagine, pretty good people. What is it about doing the contrary that's apparently virtuous?
Okay, that's a really good question. And you could have just read that one line and I would have been able to zero in on it. The concept is, and because you mentioned God in that reading, so I'll talk about that. In your daily, like if you do a daily meditation or a daily prayer, you ask for guidance. And one of the most important things in spirituality is that to ask what God's will is for you. Because there's two wills. You have your will and then there's God's will. And your will always wants you to do what you want to do. And when I asked teachers to explain it to me, it was confusing to me in the beginning of my studies. How do you know what God's will is for you? Because when it comes time when you have to make a decision and you decide what to do, your decisions can tend to be very self-serving. You do what you think is best for you. But sometimes it's the opposite. Sometimes the choice is what's not best for you or what seems like it's not best for you. So you ask the universe or you ask God what to do. And what I was taught is it's the feeling that gives you, it's the decision that gives you a sense of peace after you do it. If you make the choice to do what you really want to do, but it makes you nervous, then the chances are that that's your will. But if you make a choice that's against what you want, the opposite of what you really would like to do, but you feel a sense of peace inside, a sense of calmness, then there's a good chance that that's what God's will is for you. And that's the best answer I can give you.
Dr. Gurian,
Yep.
I want to take this opportunity to introduce one of our new faculty who brand new, November 1st, Dr. Eugene Dunn. And I'm going to let Dr. Dunn give a teeny bit of his background. And he will be teaching next semester those post-baccalaureate students who are with us tonight. He will be teaching you your behavioral science course. So Dr. Dunn, just a few words about your background, and I thank you so much for joining the presentation tonight.
Yes, thank you very much. It's great to have you here, Dr. Dunn.
Yes, absolutely. Thank you, Dr. Gurian, for your time this evening.
Sure.
Yeah, so my background is I have a PhD in clinical and health psychology from the University of Florida. My research focuses on patients living with HIV, primarily around substance use, medication adherence, and chronic pain. And more recently, my research has started to look at things similar to what you've been speaking about, spirituality and the mind-body connection. My research is funded by the National Center for Complementary and Integrative Health. So currently looking at things like Tai Chi and mindfulness. So your talk this evening is very timely, and it's great to have you back at the dental school. good to see alumni coming back even as a new faculty. And to all the students, look forward to meeting you and teaching you in the courses.
Thank you so much. It's great that you were here to participate in this. And as I said, I'm very grateful to Dean Ismail. You know, there was a time when this couldn't have happened. Well, especially when I go back to when I was in school, there was nobody talking about anything like this. And it didn't really prepare anybody in terms of thought for getting out into practice. They just taught us everything was about teeth and nothing else about interacting with people. So this is a wonderful opportunity for me. I feel that it's great that I can share this information with people who hopefully can use it in their lives. You know, it's not just about what you learn about teeth. There's a whole world out there, and interacting with people and how to handle those things is a really big part of becoming successful when you get out. So that's great. Thank you, Dr. Dunn. Is there anything else that anybody would like to ask or say?
Dr. Gurian, I had a question. Did you have trouble when you started seeing patients and working on them? Like, could you feel what you're doing, maybe with probing or doing with like the endo ice or whatever, when they feel the pain for their cavities? Like, could you feel that yourself?
Yeah, and that was really hard for me. I hated endo testing. Anything, I actually shied away from surgery. It was very hard for me. And as I said, because you manifest your worst fears. When I went into my own practice, my very first patient, I had to do an extraction. And it wasn't an impacted wisdom tooth, but it was a wisdom tooth. And I knew even then that you tend to manifest your worst fears. And so it was so perfect that I had to confront that. You know, I had worked already for 2.5 years working Medicaid offices, but this was my first day in my own private practice that I had bought. I always felt everything that I did on people. And one time a patient said to me, he happened to be a priest and he became a very good friend of mine. And I remember him saying to me, I think you'd rather hurt yourself than hurt me. And I said, yeah, I laughed. I said, yeah, you're right. And he said, well, it's obvious, I could tell. That was always my goal. I always wanted I wanted to find a way to do painless dentistry. And I spent a lot of time developing injection techniques that didn't hurt, especially for palatal injections and for mandibular blocks. And I can't emphasize enough to use topical anesthetic and leave it on long enough to be effective. Too many dentists swab it on and then they give you the injection, and especially surgeons, I find that they tend not to care as much because they think as long as you don't feel the surgery, the injection doesn't matter because the injection is minor compared to the surgery. But I'm telling you right now that if you give a patient an injection and they don't know they got one, and they say to you, are you going to give me an injection? I said, I already did. You have that patient for life, and they're so calm during the rest of the procedure. But if you hurt someone by giving them the local anesthetic, they're jittery for the whole visit. They're expecting more pain. And so the idea is to not start with pain right away, but to try to do everything you can. So yeah, and I felt it, and it was hard for me in school, but that's when I started telling myself that I'm going to work in a way that makes people comfortable. And that's why I think I told you that story when the instructor pushed my arm when I had the needle in the patient's gum, in the gingiva already, and an instructor came by and hit my arm like that and said, put it in further. You know, these days that would be assault. I would hope that somebody would be arrested for doing something like that. But in those days, that was considered acceptable behavior.
So
Yeah.
how'd you get over it during school?
Well, I still remember it as if it was yesterday. Pardon me?
Was that like a big roadblock for you, having that like empathy for people? And
No, well, as I said, I had to learn. No, it made me very effective. I had a very big practice. People enjoyed coming to me because I gave them a very comfortable environment. And I didn't joke around, even though I'm in the comedy world. It wasn't like I was telling jokes to people. I created an atmosphere of comfort. They could tell that it was really important to me that I took good care of them, that they felt good, that they didn't feel pain, and that they looked good. As I said, my specialty was cosmetics. So I loved the artistry of it, you know, and I was able to build what I would consider to be a large practice. And I stayed there for many years. And it's through using those principles. But again, if that's not part of your personality, not everyone has to be an ultra sensitive of every category, but you have to not be afraid to tap into your sensitivity and allow yourself to connect to the patients. You know, physicians don't do it very often because their patients can die. And if you don't protect your heart, and if every time someone dies, you take that in, you can't really be effective. So a lot of physicians can very often come off as being cold, like they don't care, but it's because they're protecting themselves. It's not that they don't care, they're withdrawing. But in dentistry, the only thing that could die is the person's nerve. So you don't have to worry about that. You're not going to be overwhelmed if that happens. And you can establish a connection with people. You don't have to be afraid to let them know that you care.
So then I have a follow-up question. So you said you use this to your advantage to, to excel with patient care. Do you think some of the best dentists are also like the ultra sensitives? Because it sounds like it set you apart from your other classmates.
I think it helps in life in general. You can't be something that you're not, and you can't change your basic nature. You can improve. Like if you're an ultra sensitive and you hate the fact that you're very sensitive, you're not going to be able to lose that. It's inherent in you. It's part of who you are. It's natural. So it's important to accept it. If you're a person who doesn't consider themselves sensitive at all, there is part of you that's there. It's just submerged. You've managed, for whatever reason, because you may have been brought up in a society that told you that sensitivity is bad, or that men are not sensitive. So you could be, suppressing it, but it's still there. You can develop it. You may not be able to develop it as much as a person who's a multi-talented ultrasensitive who has every single category, but you can certainly develop it to the point where your patients can feel it. And it'll definitely help you to succeed in practice. I hope that answered your question.
Yeah, thank you. Very interesting.
You're very welcome. Anybody else? Our next session, our fourth session, is going to be on my technique for I call star therapy, energy healing, to take away the physical aspects of stress and things caused by very often associated with bruxism, headaches, neck pain, facial pain, things like that, and how I use that in the clinic at NYU and how I used it in my practice. Again, I just want to thank all of you for attending. I really appreciate it. It's hard to do this when there's no audience. You're the most important people here, because I tried this once without an audience and it was horrible, absolutely horrible. So I look forward to seeing you next week. Hopefully you can come back, and that'll be the fourth in the lecture series, the final lecture. So if you liked it, please tell your friends, tell them to take an hour and share with us. And I hope everyone has a great week. Stay safe, wear your mask, and don't do anything silly. No, it's great. I'm getting a lot of thank yous in the chat, so that's really nice. I really appreciate it.
Well, the things you talk about are so important to our students as they continue their education. They'll learn all the skills. It's these other interpersonal communication, well-being that is so important. And we thank you so much.
You're very, very welcome. So I look forward to seeing you guys next week, and I'm going to click the leave button.
Thank you.
Everybody soon. Take care. Have a great week, everybody. Hey guys, thanks so much for watching the Happiness Channel. I really appreciate it. I hope you got something out of it. If you want to see more of our videos, please click on the boxes on either side of me. And don't forget to like, comment, and most important of all, please subscribe. That's what helps us to do more videos. I hope to be doing one a week. And in the meantime, I wish you another week of happiness, and I hope to see you real soon. Thanks.